Hello and welcome to the Medical, Surgical, and Observation Academy module, Time is Tissue, the identification and treatment of severe sepsis and septic shock. After reviewing today's module, you will be able to state the criteria used to identify the 3 stages of sepsis, list the assessment criteria that will initiate the safe alert in Cerner, and you'll be able to identify crucial interventions that should be implemented within the first hour of the sepsis bundle. It is important to know and identify the stages of each component. Let's look at each stage. First is sepsis, which is identified as SIRS, Systemic Inflammatory Response Syndrome, plus infection. What comorbidities place patients at higher risk for sepsis? Examples include diabetes, renal disease, autoimmune diseases, compromised immune system, anyone on steroids or chemotherapy agents, and patients with blood disorders. The second stage is severe sepsis, which is identified as sepsis plus organ dysfunction with hypoperfusion. And the third stage is septic shock, which is severe sepsis plus refractory hypotension and multi-organ dysfunction. During sepsis, the toxins released by some bacteria, especially of the gram-negative type, affect the brain's temperature regulation center in a negative way, allowing body temperatures to drop to sometimes dangerous levels. Alterations in body temperature may be frequently observed in patients. Body-wide infections may alter the host body temperature. Septic patients who develop hypothermia have a significantly worse outcome than those who develop a fever or maintain normal body temperature. Severe infections, such as sepsis, may overwhelm the body's ability to create enough leukocytes to combat the disease. Sepsis is a bacterial infection of the bloodstream, and it can be fatal. White blood cell counts can be abnormally low or high in cases of sepsis, and a blood differential may reveal the presence of white blood cells that have failed to mature. What does a shift to the left, or a left shift, mean? This diagram shows the progression from local infection to systemic infection. Beginning with a localized infection, the body responds with an inflammatory response. That inflammatory response releases microclotting factors, and at the same time there's microvascular tearing occurring in the vascular system. That tearing contributes to systemic infection, systemic inflammatory response, which creates a cascade of further microclotting. All of this microclotting and the microvascular tearing that's going on at the microscopic level allows fluid shift, which results in decreased perfusion, ischemia, and ultimately multiple organ dysfunction. Now, let's do a knowledge check. The stages of sepsis include all of the following except A, SIRS, B, severe sepsis, C, septic shock, or D, sudden death. The answer, of course, is D, sudden death, not an included stage of sepsis. Research shows us that a patient's condition genuinely begins to deteriorate 6 to 8 hours prior to a code event. This is our window of opportunity to protect the patient and to stop SIRS from cascading into sepsis, severe sepsis, septic shock. The EWS, which stands for Early Warning System, is a tool that generates a score based on the patient's temperature, respiratory rate, systolic blood pressure, heart rate, and level of consciousness. This is an early alert generated within our Cerner documentation that allows us to identify these possibly deteriorating patients. It also helps us to determine appropriate interventions. For a score of 3 or greater in the med-surg or observation area, we need to complete the task list and notify the physician immediately. You can click on the link below to show you a tip sheet, which further explains EWS. A one-time early warning system firing doesn't necessarily indicate that the patient is becoming septic. But, for example, if you follow the interventions, for a score of 4, it would tell you to perform a focused assessment, increase the frequency of the vital signs and level of consciousness, and to notify the physician when appropriate. It's time for another knowledge check. True or false? The early warning system, or EWS, is designed to alert the nurse of patient symptoms that may preclude SIRS. The answer is true. The early warning system is designed to alert the nurse prior to the development of SIRS. As stated earlier, it's most important and gives our patient the best possible outcome when we as nursing staff are able to identify the symptoms early versus later on. This prevents infection from becoming sepsis or septic shock. Early symptoms that you can identify would include an elevated heart rate, respirations that remain slightly normal, urine output that's relatively normal, some mentation changes, perhaps some anxiety. Other early stage symptoms would include an elevated blood pressure, skin that could be normal or pale, slightly cool to the touch, or slightly flushed. The temp begins to elevate in the early stages. Late stages would include a heart rate that's elevated, tachycardia, a respiratory rate that's elevated with tachypnea, shortness of breath, or air hunger. You may have a decreased urinary output of less than 50 mL an hour, and you'll see mentation changes such as disorientation, restlessness, anxiety. Other late symptoms would include skin that's cool, moist to the touch, a BP that's decreased, identified as less than 90 systolic, a temperature that's normal or low or markedly elevated. So you've got those different extremes with the temperature. Those are all late stages. Again, wanting to identify this early is our goal. Guess what time it is? That's right, it's time for another knowledge check. The late stages of sepsis include which of the following symptoms? A, skin that is cool and moist. B, a urine output of less than 50 mL an hour. C, a blood pressure less than 90 systolic. Or D, all of the above. If you guessed D, all of the above, you're absolutely right. As stated earlier, it's very important for you to identify severe sepsis very early on. Severe sepsis is identified as sepsis plus at least one organ dysfunction. Organ dysfunction includes cardiovascular collapse, as seen with hypotension, renal insufficiency, seen with decreased urinary output or an elevated BUN and creatinine, respiratory compromise, seen with tachypnea or decreased oxygenation, hepatic failure, seen with elevated liver function tests, hematologic disorders, seen with DIC, CNS, which would manifest with mentation changes, altered level of consciousness, and we also see metabolic acidosis, which is categorically an organ dysfunction. Many med-surg nurses get patients that are admitted with infection, which becomes sepsis, and as a nurse, you must recognize the progression to severe sepsis and act very quickly by notifying the physician, calling your rapid response team to support the patient's stability, and getting the patient moved to a higher level of care. Symptoms of organ dysfunction also include a creatinine elevated greater than 2.0, a bilirubin greater than 2.0, platelet count less than 100,000, a PTT greater than 60, hypoxic O2 sats less than 90, delirium assessments which come back positive, any mean arterial pressure less than 65, systolic blood pressure less than 90, lactic acid greater than 2.2, INR greater than 1.5, or urine output that's less than 0.5 of a milliliter per kilo per hour. A few things to note would include that the creatinine greater than 2.0 needs to be an increase from a prior result with the patient not on epigen or epoetin. A bilirubin total that's greater than 2.0 needs to be increased from the prior result by at least 0.5. Platelet count that's less than 100,000 needs to be a decrease from prior result, and an APTT greater than 60 needs to presently have no orders for anticoagulation for all these things to be considered positive reflections of organ dysfunction. So how can you pick up on the subtle signs that your patient is demonstrating? Well, you can watch for trending, watch for the past 24 to 48 hours, looking at things like labs, vital signs, urinary output, and mentation changes. Ask yourself, what can go wrong with this patient? Anticipate the subtle changes and signs, and trust your gut. So what is the SAFE alert? Well, SAFE stands for Sepsis and Perfusion Evaluation. The SAFE alert is a subcomponent of the early warning system specific to sepsis and the interventions that a nursing staff should take. A sepsis bundle reflects care that nursing provides to the patient experiencing sepsis. This care is developed with expectations to be delivered within specified time frames. These time frames are given to us through evidence-based practice and best practice and reflect that within a 6-hour window, the resuscitation bundle should be complete. Within 3 hours of an ED admission, within 1 hour for inpatients, and all actions within the bundle are timed from time 0 being the point of presentation. When implementing a sepsis bundle, what kind of orders should you anticipate? Well, blood cultures, chest films, IV fluids and antibiotics, a urine analysis, culture and sensitivity, blood gases, CBC, CMP, and lactic acid. Important interventions to remember include focused attention on the patient's circulation, airway, and breathing, fluid resuscitation, symptom management, a transfer to ICU or higher level of care, and vasopressors to be used in that higher level of care. Septic shock is defined as severe sepsis plus organ dysfunction plus hypotension despite fluid resuscitation. So when this is recognized in your patient, it requires an immediate stat transfer to the ICU. In summary, you have to remember that recognizing the first signs of a change in your patient's status is the difference between life or death with your patient. So ask yourself, does the patient have a known infection? Does your patient meet the SIRS criteria? Does your patient have hypotension or hypoperfusion or organ dysfunction? You will save their lives by recognizing all of these stages of sepsis and severe sepsis. And remember to use the resources around you like rapid response team to help stabilize the patient and transition them to a higher level of care. Thanks for taking the time to review sepsis, severe sepsis, and septic shock. Please remember to refer any questions or concerns that you may have to your clinical education team. Thanks again.